Hi, this is Brian, and welcome to Wait, What BS Is This? Today, I'm rebooting the series because I feel like my old series was too short and choppy in order to really connect with my viewers. So today, I'm going to start making topical videos. I'm going to try and stay on topic, and each video is going to be anywhere between 10 and 30 minutes. Now, that's a long time, and I know that sometimes hearing me makes you want to go to sleep. So I'm not worried about that. However, I think that for those that watch this, it will be enjoyable and topical. So we're going to start. The first thing I want to point out, and this is important, is that everything you read, write, hear, and say is propaganda. Now, propaganda has a negative connotation usually involved with our governments. But the reality is that propaganda is content that is either designed intentionally or unintentionally to generate an emotional or visceral response. A good example, Donald Trump's speeches or the evening news. These create an emotional or visceral response that make us go, well, why is this happening and where are we going with it? And because of this, and because news corporations understand this and politicians understand this, we get into a cycle of not necessarily less than factual installments for what we see and hear, but we don't almost never, and I mean this, never get the full story or get the full understanding of what is happening. And so we form an opinion based on incomplete information. And when we have all the information, our opinion completely changes from what we know. And it happens especially in politics, where you have these people that say, well, we need to do this, this, and this. But what they don't tell you is that when they start it, the process takes so long that if, as an example, you elected a person to the House of Representatives of Congress. In order for them to fulfill their promise to you as a voter, it generally takes 3 to 5 years to get a decent bill through Congress. This is why, even though I support health care for all, I don't support Medicare for all, because I'm on Medicare. Medicare is a pile of shit. And I hate using cuss words about it, but it is. You pay, unless you live in California and you're poor, you pay 40% or more of the cost of your health care, on top of paying anywhere from $100 to $300 a month out of your Social Security for Medicare. And add to that, it costs a substantial amount for prescription medication, and so on and so forth. Medicare for all isn't going to work. Obamacare doesn't work because they forced it through, and then they forced the insurance to start right away instead of being smart about it and saying, okay, we're going to start these exchanges. We're not going to force people who are healthy to pay for people who have pre-existing conditions for X amount of years. Probably 5 years would have been enough to get the healthcare exchanges going, to get the coverage thing going, to where people were less disincentivized to get health insurance to support people with pre-existing conditions. And the reality is that in that, the Republicans are right. The Obamacare punishes people for getting health insurance, for not getting health insurance, even though they're healthy. And while I disagree that their plan, which they don't have one, is better than Obamacare, because really people need health insurance. And that's not a question. People need health insurance. People need to be able to afford medication. They need to be able to do all these things. But Obamacare wasn't the answer, and fixing it would be great, I'm not sure with the current climate against it that it can survive as it is. And Democrats pushing Medicare for all because it's already in place is a lazy solution. It's absolutely lazy. People will understand what I'm talking about when they get their sticker shock from getting on Medicare. They'll go, who can survive on this? And like I said, the only reason I'm not punished for having Medicare, and I was put on Medicare 6 months after I started my Social Security, was that the state of California, through Medi-Cal and subsidy programs, actually pays for my Medicare, pays for most of my medication. I pay like $5 for the worst of them. And so the thing is that I'm fortunate, and a lot of people who live in California who are on Social Security and Medicare are fortunate, but there are those people who make more than the law allows that have to pay these ridiculous amounts, that have to pay $50 copays to go see a specialist, or $20 copays to see their doctor. And it's ridiculous. 100%. But this is the kind of thing we're going to be talking about. This I would like dialogue about this, because people don't understand, don't have all the information, and then they go, well, the Republicans are wrong for trying to take away health care. But the reality is the current system was broken before it even began. And there are probably parts of Obamacare, like the mandate, that could be fixed and incentivize people for getting health care, because that's really where it should have focused. It should, instead of taxing every person, pardon me, for not getting health care, they should have incentivized by saying, okay, well, if you get health care and you keep health care for, say, 10 out of 12 months or whatever, through an exchange, you get X amount of dollars off your tax bill. And that would have been much more palatable than saying, okay, well, if you don't have health care, you have to pay $250 a year, or whatever the penalty is. I can't remember. I'm not going to look it up right now because that's kind of silly. But reality is that in order for it to be fixed, we have to have politicians that have maybe an incentive to fix it. And right now they don't, because the healthcare lobby, even though the taxes on Obamacare for healthcare companies are a little weird, to say the least. Like, healthcare equipment companies have to pay taxes, and healthcare CEOs have to pay taxes. But healthcare companies in general are happier, because if you have to buy insurance, they make more money, especially if you're healthy. So where do we draw the line? We have to figure something out. I don't think single-payer healthcare is really a possibility here, although I would like to see a Supreme Court ruling saying, well, X state can do this, where a state instituting a single payer healthcare system would be able to do so without being punished by the federal government, to see if it could actually work in, say, a smaller state like Rhode Island. Here in California, the actual budget estimate for a single payer system as of last year was $400 billion. Now think about this. The economy of California is roughly $600 to $800 billion. That's not going to work. Not to mention the fact that even especially under Obamacare, where health care professionals are in direly short supply. I mean, when you have people who aren't doctors treating you and they don't have the experience, and being able to prescribe medication is not the same as being a doctor. I don't care what you say. Having experience and understanding conditions is great, but if you haven't studied them, then you don't know. Like, for example, I could have cancer, but if I'm seen by a nurse practitioner who only knows general care and is only capable of prescribing medication, then whatever condition I suffer from, he or she doesn't understand, that becomes a problem. And it happens especially with the poor, and it's tough. It really is. So this dialogue about Medicare for all, about healthcare, really needs to get somewhere holistic. We have to realize that maybe we can do a single payer system that allows people to pay for concierge care. Maybe we need to do a single payer system that allows people to travel to other countries for care because their systems are already in place. But usually those options are reserved for the wealthier and well-to-do. But we don't have those options now. And we need to make those options available. I don't have the answers on this. There's a lot of moving parts. A lot of people will be pissed off by my opinion. And to be honest, if you're offended, okay, whatever. I mean, because really the object is to start people to talking. And as I stated at the beginning, everything is propaganda. Everything that we say and do impacts what other people say and do. And if we don't talk about it, nothing will ever get fixed. Okay, so this is I'm done with my first video. I will be trying to do 1 or 2 of these every few days so that there's more content. Next time we can talk more about other stuff. But for today, healthcare is fun. Anyway, have a great day.